Hey everyone, it's Dr. West and Brandon. I'm going to tell Brandens' story, and I don't want to steal any of the information that he's going to talk about because it's really neat. And the story just told me, like, I still got goosebumps on it. But number one, Brandon, when you first came here, how did you feel?
I was pretty numb. I think my body was really overwhelmed. I think that it was so overwhelmed I didn't really know how sick I was. It's one of the things with Lyme is that, like, sometimes the sicker you get, the number you feel and the less you feel. And so I was sort of trapped in this, concrete body and just didn't know how sick I was, but I knew I wanted to keep moving forward and try and progressing and getting better. So,
and that led to a discussion we had a little bit earlier because you had been sick for a long time. How long have you been sick?
I've had Lyme for about 20 years, actually. I got it about almost exactly 20 years ago. So it's been a long journey.
And so you came in here, and just like so many of our other patients that have complex and complicated healthcare conditions, you're like, I'm tired of paying for stuff if I'm not going to get better. So it wasn't belligerent, but definitely, cautious, skeptical. And I tell people the reason why you're like that is because you don't want to get your hopes up. You're thinking you're going to get better and then be let down again. But we started off with Lyme. You've been sick basically half your life. What were the treatments and then what happened?
So just to back up a little bit, I actually went to, I think it was 15 or 16 providers before Dr. West.
So I'm Dr. 17?
Yeah,
okay.
That's right. And I think around seven of them claimed to be Lyme literate. And so when I got here, I was pretty skeptical. But we got some IVs, like vitamin C IVs and a bunch of other glutathione and some other stuff, amino acids. And those have been super helpful. And I've been on the course of those. I came up about once a week for maybe for a couple months or something. And then I just kind of slowed down a little while, like every 2 weeks and then once a month. I've been doing that for about 2 years, but yeah.
The fun part about this is when I ask you, well, how do you feel compared to where you started to now? How do you feel?
Super awesome. Like I'm really stoked. Like I have my life back, and a lot of it was erased or sort of neutralized because I was laying on a couch for most of my life, and so I got it back. So I'm pretty excited about that.
So Brandon, what can you do now that you couldn't do when we first started working?
I can play with my kids more. That's probably the best thing. I can engage in their lives, take my boy on walks and stuff like that. Like, used to I was able to work a full-time job for the last 5 years. Before that I wasn't able to, and now I can go to that job and have energy left over afterward to take my boy on a walk or do things like that. So it's really exciting.
It's awesome, Brandon. So we did infusions, we've done some neural therapy, we did some nutrition therapy. You took control of your life. You had to do some work over there, and when I say over there, you had to do some emotional work that I'm really proud of you for, because sometimes people don't like they see it and then they either resist or they run away. But you paid the price to do the physical treatments, you did the emotional freedom work, you put some relationships in parameters. I mean, it's just an all-around awesome thing. When you were telling me earlier, I just wanted other people to hear this because you're not your diagnosis. Like, you can totally beat this. Brandon, is it okay if I share this message with others?
Yeah, sure. So you should come to Dr. West. It's a really great place here. They have a really great team. And one of the best parts is that you feel like people really care about you, and you don't feel like you're at a doctor's office. Like, guys aren't really into day spas, but it kind of feels like a day spa more. It's kind of cool to come here and feel validated for the legitimacy of the disease, how serious it is, but also that there's a path to get better and there's a way out, there's hope. And that's what I love about the West Clinic.
And what's fun about this too is our plan for Brandon moving forward is we're going to help him so that he doesn't have to come to the office. So he's 90+% better. And I asked him, how do you want me to treat you? And he's like, just make sure I'm not skipping we're filling in all the holes. And then I'm like, well, hey, let's just get a reevaluation with you sometime next year. It's fun to say that because my goal was to empower Brandon so that he doesn't need us. And he's there, and so we're going to check him. And next year, 2021, it's going to be a great year. Brandon, it's been an honor to take care of you. And of course, we're going to stay in contact. It's just not very often.
Yeah, but that's one thing I like about your practice is that the term I used earlier was health self-reliance, right? Like, what I love is that I feel like you're trying to empower me and help me gain knowledge about my condition and how I can improve it, but also to help me. I feel like your agenda is to actually get me better, not just keep me come through to run the cash register, right? So, I really appreciate that. So,
You're welcome,
thanks.
Brandon. So Dr. West and Branden at the West Clinic, your daily dose of vitamin H stands for Vitamin Hope, and we'll share this for other people. We'll see you guys on the next video.